Now, to visualize the investigations in the tutorial, we need to know the SchrDbb algorithm. So the investigation, the first element of the investigation, you are going to start with the goals of the investigation. First goal of the investigation is to investigate for the disease. You investigate for the differential, you rule out the differential, and you rule out the endemic disease, which may cause symptoms like pre-eclampsia. The next thing is you have to investigate for the cause, you investigate for the complication, you investigate for the background, and investigate for the prognosis if there is any investigation for that. Okay, so now we start with the investigation of the disease. So you need to know that what so we start with the investigation of the disease. Now, to investigate for the disease, I tell you always to start with the principle of investigation, and the principle of investigation is supporting before confirming. Is it clear? Now, to investigate for the cause, the complication, the background, and the prognosis, you now use instead the means of investigation, which is laboratory and imaging or radiologic. Basically, which is laboratory and imaging or radiology. So those are the different things that you are to bring out when you are speaking about investigation. So we start with the first one, which is investigating the disease and by supporting and then confirming. So the disease in this case is hypertensive disease. So the hypertensive disease first is which can be pre-eclampsia. First, to the diagnosis of pre-eclampsia, we know that what it should be made with the blood pressure and the urine. Is it clear? So to support your diagnosis, you have to evaluate for the blood pressure of the patient. Is it clear? So when you take 1 instant blood pressure, is it clear? It can support already your diagnosis. So if you take a blood pressure and it is more than 140/90 millimeters of mercury, or you have an increase in blood pressure by 30 or over 50 millimeters of mercury, you can support that it is pre-eclampsia. Now, the next thing is also to support, you can use a urine dipstick. Basically, the urine dipstick can help you also to support that it is pre-eclampsia. And urine dipstick can see proteinuria. But now, to confirm the diagnosis, basically to confirm actually the diagnosis of the patient, you have to actually have the confirmation that the patient is hypertensive. If the patient was moving from a strenuous exercise, let's say the pregnant woman was doing a strenuous exercise, she was carrying a heavy load, and then she came directly to our hospital, it's normal that her blood pressure is going to be elevated. Is it clear? To confirm that this patient is actually having elevated blood pressure, what you do is that you measure the blood pressure at 2 instances, at least 6 hours apart, and with the patient at rest. So if you measure the blood pressure at 2 instances, at least 6 hours apart, and then you realize that blood pressure is still greater than 140/90, or it has still increased by 30/15 millimeters of mercury, means that patient is actually hypertensive, and this is the conclusion of a hypertensive disease in pregnancy. Is it clear? Now, the second element is to confirm that there is actually proteinuria. Is equal to confirm that it's actually proteinuria, we are going to collect the urine sample in 24 hours. Is equal, and when you collect the urine sample in 24 hours, you measure the protein level of urine sample in all the 24 hours. It has to be at least 300 milligrams. That one you confirm now that the patient is proteinuric. Is equal. So those are how you do for supporting and confirmation of preeclampsia. Now, the next thing is to evaluate now for the cause. Generally, you need to know that what preeclampsia has no cause, so you cannot investigate for the cause. But you need to know that if you cannot investigate for the cause, generally you need to know that everything that is of acute onset always have precipitating factors. So you may not evaluate for the cause, but you may evaluate for the precipitating factors of hypertension. Is it clear? There are different precipitating factors of hypertension. Is it clear? And those precipitating factors are generally instances of stress. Is it clear? The mechanism of stress that you can have is generally sympathetic stress. Is it clear? You have two major types of stress: sympathetic stress, or you have cortisol or glucocorticoid stress. Is it clear? So those are the two main types of stress that you can have. You can have sympathetic stress, or you can have glucocorticoid stress. So those are the two main major types of stress the patient can have. Is it clear? Now, when you have these two stress, there are etiologies of these two stress. Is it clear? Etiologies of these two stress. And the etiologies of these two stress, generally, you have the 8 I's. Is it clear? So the first 2 I's, you have infection, is it clear? And you have iatrogenic. So when you are you're taking too many medications and you are infected, it can be causes of stress. Is it clear? It can be causes of stress, infections and iatrogenic. The second, the two other ones, you have infraction, and you have illegal. Is it clear? Infraction, like in the case of trauma, when you have a trauma to the patient, it can be an instance of stress. So if a woman has trauma, it can be an instance of stress that can result to an increase in blood pressure. Is it clear? So illegal also, anything that is done illegal. Is it clear? Like taking, when you are saying illegal like that, you are saying that the patient is actually consuming illegal products like morphine, the patient is taking smoking, the patient, all those products that is not advised in pregnancy, alcohol consumption, smoking, all that can be the precipitating factor. Is it clear? The fifth one, after that, we have, okay, the next instance of stress can be in a state of ischemia. Is it clear? So if a patient has any ischemic disease like the ischemic heart disease, he can have a peripheral vascular disease, all that can result again to stress. If the patient has the infarction, is it clear? So the next set of eyes is in ischemia and infarction. If the patient is infarcted, like myocardial infarction and all those other ones, you can have a period of stress. Is it clear? Now, another etiology of stress is going to be infant. Generally, pregnancy, infant, the I for infant is for pregnancy. Pregnancy is a state of stress. Is it clear? Should there be those two elements, sympathetic stress or glucocorticoid stress? Is it clear? And then the last one, after infants, we have now idiopathic. Idiopathic are the other causes of stress, and the other causes of stress now, you can have psychological stress, basically, which can result to an increase in blood pressure, like also the father of the patient is not there. Those are psychological stress.